It's usually only like 2 questions on here.
For lab?
Yes.
And this is usually one of them.
SF 545 is, I don't know. It's like the DD771. I can never forget what that form is. If anybody doesn't ever know the 771 is your eyewear one, that one's beaten into your head like everything, right? Same thing with 545 is always going to be your lab report display. But question for you, since we're going to precursor to records, where is all ancillary services kept in your medical record? Part 4. I actually made this PowerPoint. All right, blood collection methods. I wanted to show everybody that the antecubital fossa, because that's been a test question before, is the what's the word I'm looking for? Preferred site for getting blood collected. Bevel up, and this has been a test question too. What angle? What does it say up there? Anybody see that? 15. 45. Oof. So, okay, antecubital fossa. You have it. I'm using this as a fulcrum. And I have the needle here, bevel up at 15 degrees. Insert it in. I did wipe it beforehand, just so you know. Wipe the site first. Put it in. Wait to see the flashback. Once the tube's filled up, pull out the tube. Make sure you release the tourniquet so the blood actually flows through. Put a piece of gauze on there. Wrap it up. Same way as an IV, even though people get scared more about IVs when they do it because a lot more blood comes out right away. Coming from a fellow dental tech that used to suck at IVs, if you're scared of IVs, you need to start doing them more. It's the only way to get not scared of doing them. All right. Now, know that your tourniquet for teachable C is different than your tourniquet in lab. I think it's 2 inches above in teachable C, 2 to 3 inches above for lab. Okay? Antecubital fossas we talked about, venipuncture method, 15-degree angles, all that stuff I just showed you in the chart. Okay? Do not leave the tourniquet on for more than 1 minute. Common sense, right? But yet, the easy way to remember it is how quick should a tourniquet be put on Triple C? No more than a minute. Okay? No more than a minute should it take you to put a tourniquet on a Triple C, and you shouldn't leave a tourniquet on for more than a minute in blood collection. That one's on the test right here. Okay? Both of them, actually. So you massage and notice the finger, repeat the milking 5 or 6 times, and then this one right here that nobody ever studies. Okay? Cleanse the fingertip with alcohol pad, wipe away the first drop of blood to avoid dilution. They will talk about that on the test. So wiping away the first drop of blood. Okay? And for babies, heel or great toe. Okay, I also took this straight from the core manual. I like to put pictures from there on here. So, these are the angles of the incorrect and correct. I don't know what they do at hospitals, but like Corman, I think gives.
That's like your first day of course school.
Mm-hmm. Or that nurse you have at the hospital. Some of y'all know what I'm talking about. Take 5 or 6 times to get some shit in you. Alright. How many inches?
2, 3, 1 minute.
Okay. And what is the angle?
15.
Not 45.
11.
90.
Alright. So, I don't think they'll ever have this. Some of y'all might remember. They actually put a picture of a microscope on the test one time.
What?
When I was up for HM3, they had a picture of a microscope on the test. Now these, I like to have a way to remember them because they do kind of ask about what does this, right? Okay, an arm is used to, a regular arm, right? We're used to support each other. Okay? So an arm supports magnification. Okay? A stage. I think of a stage right now. Usually on a stage they have a light going to the people on stage. So a stage is actually allows passage of light. Okay? The mechanical stage, okay? So you have your stage, but you have something like a prop that's on a stage, okay? That's going to hold that in place. So a mechanical stage holds the specimen. Okay? And then the base, just like everything else, everybody always rests on a base, or everybody's home ported on a base. The base is where the microscope rests. Okay? I do stuff like that because what they like to do on lab is they'll ask you definitions of a microscope, and you have to explain what part of that microscope it is. Okay? Usually it's holding the specimen or supporting magnification. It's usually on the test. There's an easy way to remember these numbers too that we're about to go through. Okay? Internal light source. Okay? Precise and steady source of light. Okay? What does it mean to condense? Make it smaller. Okay? So, make it smaller. If you read here, it concentrates and focuses light from the light source. So it takes one big light source, makes it smaller. Okay? You're literally paying attention on what these terms are and make sense of what the definitions are. Okay? Iris diaphragm, this one's been on there before, on the test. Controls the amount of light and angle of light rays that will pass through the specimen and lens. Iris diaphragm. Okay. Now, people miss over this part and just study this part. Okay? The lens nearest to the eye is the ocular lens, so they use the term ocular lens. It's looking at the body too and has a magnification power of 10 times. So ocular lens is 10 times. Okay? Low power level is 10 times. High power, 45. Oil immersion, 100. So 10, 10, 45, 100. But people always miss over the ocular lens. Okay? And then your other 100, oh, it just said the same thing for blood and bacterial smears. Okay? I think I've sometimes seen this one. The camel hair brush. Because it's something odd. Alright? So microscope is cleaned with a camel hair brush. Alright, 5 things that make up your CBC. Okay? RBCs. WBCs, so red blood cells, white blood cells, hematocrit, hemoglobin, differential. Okay? And they ask the 5 parts, it's those. Red blood cells, white blood cells, hematocrit, hemoglobin, differential. I think they usually ask how many parts make up a complete blood count. It's usually what they throw on the test. I got nerdy and put a hematocytometer on there. I know you're never going to need to know for the test, but that's what it looks like. Yep. Now this one. Okay, so I'm about to use some logic here that I've talked about with other subjects. Okay? Who did I say is the most immunocompromised people? Babies and older people, right? So if you're more immunocompromised, then you require more to fight off diseases. Okay? So always know that your newborns are going to be the higher amounts in these. Okay? Now, if I'm not mistaken. Alright, so we have 4.2 to 6, 3.6 to 5.6, 5.0 to 6.5. Keep those numbers in your head because you're about to see where they correlate on this next slide. Okay, now these right here. So if somebody has a low red blood cell count, what does that indicate? Anemia. These are people that chew on ice all the time. Okay? A red cell count that's above normal indicates what? Mm-hmm. Dehydration. Guarantee those have been test questions. Okay, so I'm about to do a little flipping here so you see this. Okay. So you see hematocrit, it says 42. What does it say for red blood cell? 4.2. Okay. It says 3.6 for adult female here, right? 37. 36, 37. Why does it keep doing this? And then 5.0 to 53. So they're both 5s. Okay? I say that because if you're trying to remember a bunch of numbers from lab, try to correlate the shit that's already same. Okay? And then you have here 12 to 16. So each of these add 4 except for infants. Right? 12 plus 4 is 16. 4 plus 4, 14 plus 4 is 18. So 12 to 16 for woman, 14 to 18 for men. And then 5 for baby. Or 6 for baby. Okay? I say that because those numbers are kind of hard to remember, but they will ask you one of these values. And you have to know what the male or female or newborn is.
In the last test, they asked the definition of hematocrit.
Mm-hmm. So, ratio of red blood cells to the volume of whole blood is the hematocrit. So, yes. I mean, to me, that's the definition that kind of stands out to know. But just know that it's due to the ratio of RBCs to whole blood. Well, it probably asked about hematocrit because of this right here. Remember how I said they love the word mosts? Microhematocrit method is the most accurate manual method of determining blood volume. What is the most accurate manual method of determining blood volume? Microhematocrit. Okay. Here's another one where if you see trends, it makes sense. What's 5 times 3? 5,000 to 15,000. What's 10 times 3? 30. 10,000 to 30,000. Okay? You know you're multiplying each of those by 3, and it's going to give you your ranges for children and newborn. This is the only time they mention children also. The other ones mentioned male, female, and infants, right? This one has adult, and then children and newborn. Okay? And again, to know who is ranked higher, who has the lower immune system? Babies. So they're going to have the higher amount. And then children will be the one below that, and then of course adults below that. Okay? There's a reason why it's in this order. So leukocytosis is an increase in your white blood cells. Okay? PMA is the terminology we use here. There's a reason why it's in this order. Performance mark average, right? Or pneumonia, meningitis, appendicitis. That is what a high white blood cell count is an indicator of, are those 3 diseases. Pneumonia, meningitis, appendicitis. Alright? Leukopenia. Okay? I don't want to tell you why I remember penia as low, but it sounds like it should be a low word. Right? So penia is abnormally low. Okay? These are the diseases that are associated with it. I don't have an acronym for those. I would just pay attention to the ones that really stand out to me. Never seen this one on the test. I can't. Yeah. I have seen this one. These two. Typhoid and then your rickets. All right. 5 types of cells, of white blood cells. Okay. This is where words are going to confuse you. Okay? Basophils are large, dark blue granules. Okay? But your monocytes are the largest normal white blood count. Okay? So when you see the word large, know which one is talking about the dark blue granules and which one's talking about the largest white blood count. Alright, so reddish orange for eosinophils, they destroy parasites. Okay, basophils are for inflammatories. Lymphocytes are with immune response. So usually when you're sick, it's dealing with your lymph nodes. It's how I remember lymphocytes. Monocytes, okay, dealing with, so I think of like mononucleosis, which is to me is kind of some microbial or fungal type thing. So I remember microbial and fungal infections, and they are the largest one. Okay, again, I want you guys to not mix up colors. Lymphocytes are clear sky blue, and basophils are large dark blue. Okay, know which ones are sky blue and which ones are dark blue. Okay, and now this is where I said large comes into play again. Largest percentage. Okay, neutrophils, the largest percentage of leukocytes found in normal blood. Okay, so largest percentage, so most amount. Okay, largest white blood cell count for monocytes, and then large dark blue granules for basophils. Okay, if I'm writing a test, I'm going to make you confused by putting those on there. So really need to know what it's talking about. Okay, shift to the left. These have been on the test. Okay, shift to the left, percentage of immature cells increase. Okay, so I want this to make sense for those that don't understand it, right? Falling white cell count, the number and maturity of neutrophils progressing toward normal indicate recovery. Okay, what's the purpose of white blood cells? Fight infection, okay? So you produce a bunch to fight the infection. If your white blood cell count is going down and your neutrophils are increasing, what do you think is happening? You don't need as many white blood cells. You're getting better. So associate falling white blood cell count with recovery. Okay? Okay? A continuing shift to the left with a falling total white blood cell count. So this is where there's maturity in the neutrophils. But if you have a shift to the left, so basically your body is not making more white blood cells, and it's having a hard time to fight off those diseases, meaning that you're getting sicker, is where a poor prognosis, a poor recovery time is happening. Okay? So continued shift to the left, you need to associate with poor prognosis. All right. All right. Pathogenic causes disease. Non-pathogenic does not. Okay? I said this before. This should be in a different order. MONT is the term we use. MONT. Moisture, oxygen, nutrition, temperature. 4 growth requirements for bacteria. Okay? Psychedelic. Usually you're kind of good, in a good mood, slower talking. Think of like Cheeky Chong, right? Low temperatures. Okay? Mesial, middle is going to be your body temperature. Okay? Thermos, hot, going to be your high temperature. So psycho low, meso middle, thermo high. Okay? The shape of these is in the name. Okay? Coccus sounds like it's a sphere. Sounds like a circle. Right? So a coccus is going to be spherical. Bacillus, okay? Harry Potter fans, I call it Bacillus because I'm a Harry Potter fan, right? Think of the snake. Okay? Snake is kind of like a rod shape. Spirochetes, okay? Spiral, cork shape. You see how the name of how it's described is already in the name of it. Okay, we're going to break down prefixes here. What does endo mean?
Outside of, or inside of.
Okay? So, endotoxins. Part of the cell wall is related to bacteria destroyed. That is within. Exo is what?
Outside.
Okay, so surrounding. Right there. You see the word surrounding. For growth requirements of bacteria?
Moisture.
Yes. What are the shapes?
Sphere, bar, spiral.
Or cork shaped. Alright, this one right here. Okay, I have a weird way to remember it. Some of y'all will probably laugh. Okay. Some people aren't always happy about possibly becoming pregnant and they get nervous and scared about it, right? So sometimes I think of gram negative and I think of pink as a female. Yay, I'm not pregnant. They got a negative test back. Gram negative, counterstate pink. Okay? And then the other one, the gram positive, is counterstained violet.
Because you're going to get violent when you're pregnant.
Okay. Crystal violet. Primary stains 1 minute. I don't think I've really seen it. This one is violet. Safranin. Counterstain 1 minute. Okay. Lab is all about confusing you and trying to confuse you. Okay? Now, where's it at? Okay? RPR and this one are both tests for syphilis. Okay? So don't just say, hey, test for syphilis is this. No. RPR is a sensitive performance screening test for syphilis, right? Now, more precise test and used to confirm primary, secondary, and late syphilis is this one. The fluorescent treponema antibody absorption test. More precise in all of these phases is this one. The standard general one is RPR, rapid reagent test. Yeah, plasma reagent. Okay, that makes sense? Okay, this one right here. Okay, what's the letter for potassium?
Okay.
Okay, and hydroxide. All right, so if they don't use potassium hydroxide and say KOH, you know it's potassium hydroxide, and usually that's always going to be related to detecting fungi. Okay, this one is in the name. Mononucleosis. Testing for syphilis. What's used to detect fungus? KOH. Monocyte or dry spot is used for what? Gram negative? Positive? What did I say about your saliva? There's your urine. Okay? Okay, least valid specimen. They love to ask about urinalysis questions on the test. Okay? Your least valid specimen is random urine. Okay? They will ask that question on the test, and they're going to ask the best sample for routine urinalysis, which is first morning urine. Does anybody know why? It's most concentrated. Okay? Most concentrated. Meaning it's going to give you the best results of, it's not going to be diluted throughout the day. Alright? 24-hour urine specimen, we already could see what that is. Okay? Now, know the range? 600 to 2,000. Okay? And then, these have been on the test before. Okay? Reduced. So this is going to make sense, right? What is, not to get gross, what's diarrhea? What's the concern with diarrhea? Dehydration. Okay? So, if you have dehydration, are you going to pee a lot? So, diarrhea, if you're sweating, reduces urinary output. Diabetes, when you're putting more liquids in your body, is going to be associated with increase. See how that makes sense? All right, colors. The colors are kind of in the names too. This is one of those other things that kind of goes in line right there, right? I don't know why. Child sounds like a milky white color to me, right? So milky white and child go together. Okay. Phenols, olive green, brown, black. It sounds like it would be the color of an olive, right? Phenols. Okay. Bile is already kind of a yellowish color. Okay. We already know red is blood. Okay. Blue-green is the color of, I guess we get to talk about meth a bunch of times today. You can think of it as blue meth, right? So blue-green is going to be Nestling blue. And then dark orange, Peridium. Easy way to think of that is, anybody any Frank Ocean fans in here? Frank Ocean has a Pyramids album, and it's like an orange pyramid on the album cover. I hope you remember that Peridium is dark orange. Okay, this one is always on the test. Cast is an indication of some form of kidney disorder. Know that. Cast. I've seen that on the test multiple times. All right, let's see if you remember the colors. Blood, bile, methylene blue, phenols, Peridium, child. Okay, so do not mix this specific gravity up with your other urine stuff that you're studying. Okay? Okay, I like to know numbers that make sense. What's 15 times 2? 1.015 to 1.030. These are the ways that I remember these random shit that I can speak to you because stuff like that. I already know that it's double that amount. Okay? Now, in the presence of disease, this is a test question here. So this is the normal specific gravity, 1.015 to 1.030. The presence of disease, 1.001 to 1.060. Normal range? Okay? That's correct. All right. White blood cell count above 50,000. I'm telling you the ones I've seen on the test. Above 50 is acute infection. Okay, this one's been on there. Hemoglobin below 7 indicates severe anemia. Okay, glucose and ketones that are both positive indicate what? Uncontrolled diabetes. Okay, and then this one, always on test too, a minimum of 10% of certain shipped companies is required to be enrolled in the walking blood bank. Any questions about lab? Lab techs, they do a good job? They hit all the points that need to be hit?